Hello, everybody. Good afternoon. It's so wonderful to see you here today. My name is Rebecca Andrade, and I'm the Educational Programs Manager here at the Kansas Health Institute. And I would like to welcome you to our fourth session of the 2025 Bring It Learning Series, Advancing Age-Friendly Kansas Strategies for Impact. So Bring It is a learning series offered by KHI, and it's really just a chance for us to come together over the lunch hour to chat about different health policy topics related to issues that may be considered during this year's legislative session in Kansas. And so we call these Bring Its because, again, it's a chance for you to bring your lunch, your questions, and your perspectives on the topic at hand. And so, a little bit about who we are. KHI, or the Kansas Health Institute, is a nonprofit, nonpartisan educational organization based in Topeka, Kansas. And we were established in 1995 with a multi-year grant from the Kansas Health Foundation. We are guided by the vision that Kansas will become the healthiest place to live through evidence-based and innovative strategies, policies, and practices. And so we work towards this vision by providing nonpartisan information, convening crucial conversations, and facilitating learning that leads to meaningful change. So if you visit our website or you stop by our building, you'll see that our work involves research, evaluation, technical assistance, policy analysis, as well as podcasts, blogs, and gatherings like today's Bring It session. We are offering a total of 5 Bring It sessions, and the final one is next Thursday, March 6th. So the topic will be navigating AI and exploring opportunities, challenges, and policy development. So there's a really dynamic panel that will be hosting a really wonderful conversation surrounding how we navigate AI in this context. So if you still need to register or you would like to share the information with somebody in your network who might be interested, you'll find that link in the chat or on our website under the events page. And now it is my pleasure to introduce my colleague Emma Urich. Emma is an analyst here at KHI, and she has been doing a lot of really great work with the Age-Friendly Kansas Initiative. And so Emma will be presenting and facilitating today's session. And I'll pass it over to you, Emma.
Thanks, Rebecca. All right, good afternoon, everybody. Like Rebecca said, I'm the lead facilitator for the Age Friendly Kansas Initiative, and we're so grateful you all were able to join and learn more about this statewide initiative that we've been working toward over the past year, and then also keeping up with what we're looking at ahead for 2025 and early 2026. So we have a great lineup of speakers today. We're first going to be hearing from Derek Flerlog, who is the director of the Bureau of Family Health at the Kansas Department of Health and Environment. Next, we'll be hearing from Chrissy Khatib, who is Deputy Director of Adult Protective Services at the Kansas Department for Children and Families. And then last, Dan Klukas, who is serving as Securities Commissioner at the Kansas Department of Insurance. And so for today's agenda, I will be giving an update on the Age Friendly Kansas initiative and some of the work our steering committee of state agency agency directors have been working toward over the last year, and also our stakeholder advisory committee that has been meeting over the last several months and will continue to meet in 2025, and some of the goals we hope to accomplish in early 2026. Derek will be presenting on intergenerational care models and efforts the state is taking to expand those models and some of the licensure requirements around that. Chrissy is going to be looking at addressing financial exploitation and the efforts APS is taking to address and prevent exploitation, and also just really looking at what financial exploitation is and some of the impacts it has on older adults in Kansas. And then last, Dan will be presenting on some efforts the state is taking to educate older adults on financial literacy, as well as how that supports aging in place and then also preventing financial exploitation as well. And so, looking at the Age Friendly Kansas Initiative, we've been busy for the last several months with meeting with a multi-stakeholder advisory committee. This advisory committee is multidisciplinary, bringing together folks working in aging, public health, healthcare, academia, advocacy, and several other disciplines. And so that advisory committee really hopes to transform all these different insights from across these disciplines to create system level improvements and changes across Kansas that really focuses on enhancing the health and quality of life for all aging Kansas across the lifespan. And so part of this initiative, and there's several age-friendly initiatives in different sectors, systems, and on topics throughout the state, but this initiative, Age Friendly Kansas, really hopes to bring together all those different initiatives, the stakeholders who are involved, research, resources, and expertise to really work toward a statewide action plan that would cover the next 1 to 3 years. And it really hopes to go just beyond raising awareness, but really drive real change to make Kansas a more age-friendly state. And so that's part of what we're doing here today. We're raising awareness on some of the issues that impact older adults, and then we can hopefully have you all take away some strategies um, to improve the health of aging Kansans. And so part of this initiative is looking back on where we've come or where we've been and where we're going. So in fall of 2023, the Kansas Health Institute was selected to support age-friendly public health systems. That is an initiative that is spearheaded by Trust for America's Health, the John A. Hartford Foundation, and the National Network of Public Health Institutes. So KHI is part of this cohort of public health institutes that hopes to build capacity for state agencies and other stakeholders across the state to think through age-friendly practices and principles. And so last fall, we really officially launched the Age Friendly Kansas Advisory Committee of those multidisciplinary stakeholders, and we built capacity to start thinking and kind of speaking the same language around age friendly. And we heard from state and national speakers on a variety of different topics related to transportation, preventing and addressing social isolation, as well as age-friendly housing and community neighborhood development. And so what really emerged from these conversations was that public health is broad and touches so many different aspects of our daily life. And so we ended up working more toward an age-friendly Kansas ecosystem approach, which I'll talk about in the next slide. But here we are in January through December of 2025. And so we broke up our advisory committee into working groups to really focus on specific topics that we worked on last fall. So strategies are being developed in different domains, including transportation, cross-system collaboration, public health initiatives, as well as healthcare access, and other topics. And then with the hope, we will be developing and capping off this initiative in March of 2026 with the Age Friendly Kansas Action Plan, really focused on the next 1 to 3 years, and also capitalizing on the efforts of other age friendly initiatives going on across the state. So if you want to catch up on some of the resources and see what the advisory committee learned in the fall of 2024 and just see the types of presenters we had, you can see the Age Friendly Kansas landing page on the KHI website. This is going to be part of your resource guide you'll be receiving at the end of today's presentation, and you can just catch up there on some meeting minutes and some great presentations. And so I mentioned this earlier, but when the different domains emerged within our advisory group, it was clear that an age-friendly ecosystem approach would be necessary to bring together all these different initiatives and ideas and sectors and stakeholders to really have this unification um, under the public health umbrella. Because public health does take a broad view of health, recognizing all the different social determinants and things that impact our health in our daily lives. So with this ecosystem approach, we're really trying to collect insights and hear from maybe some non-traditional public health stakeholders who wouldn't necessarily call themselves public health, but nonetheless impact health within their work or within their respective sector. So that's kind of what we're doing today. I think, as you know, as when I was receiving my master's of public health degree, we did not hear about financial exploitation. We did not hear about financial abuse. And so this is definitely an emerging topic and priority that I think we as public health practitioners should be aware of. And so that's our hope for today's presentation. And so I've kind of mentioned age friendly, and age friendly is really this concept of thinking through policies, practices, environments that promote aging positive principles really across the lifespan. And it's really looking at ways in which we can think and approach work and create a society that really just supports aging and takes aging considerations into consideration. So I want to pause here, and we have 65 folks online today, which is a great turnout. I'm so happy you're all here. And I would just really like to hear in the chat What is one age-friendly policy or practice? Maybe it's a program or something you do in your work that you see every day in your daily life or in your career. And we can just take a pause and see where people are coming from and what age-friendly means to them. So I'll just give you a moment here, and then hopefully we can call out a few remarks as we get through today's presentation. All right, our first edition here, immunization outreach at senior living facilities, definitely public health. Working on addressing social isolation, yes. So our advisory committee last fall heard a presentation of some work going out in Hutchinson, Kansas, where there was a collaboration between some mental health providers, the health system, and a kind of coffee shop and art studio where prescriptions for friendship were given to older adults who were identified as having not a lot of friends or support. So doctors were actually writing these prescriptions and they could go to this coffee shop and get free coffee and maybe an art lesson. So that's a really great model that we heard about. Yeah, transportation issues. We're working to address some of those in our advisory committee. Transportation options for folks on Medicaid. Exercise, physical activity. Yes, so important for people with mobility issues. Thank you all for providing some of those thoughts. And keep them coming as we're going through our presentations today. And also, as we're going through presentations, we'll have time for Q&A and discussion. So please continue dropping your questions in chat or using the Q&A feature for our presenters. And we can have a great discussion in between our presenters today. So with that, I'm going to turn it over to Derek, and he will be our first presenter for today.
Well, hi everybody. Thanks for joining us all today. I was really excited to get the invite to present anytime I can talk about the topic of age-friendly policies, public health work, and then especially when really long-term care and childcare cross paths. That's really exciting for me. My name's Derek Flerlog. I'm the Bureau Director for Family Health for the Kansas Department of Health and Environment. I'm also a former long-term care director, and so that's kind of the reason that the concept um, really just I think makes my heart warm. So I got a soft spot for people all across the lifespan, as we say here at KDHE. Try to go here. There we go. Perfect. Okay. So a little bit of background on our program, just so everybody understands. I don't expect anyone to come away with like a civics 101 certificate here on government structure and bureaucracy. But our program, the child care licensing program itself, operates within our bureau, the Bureau of Family Health here at KDHE. And so, real quick, brief, we have 3 divisions at KDHE. There's public health, there is environment, and then there's healthcare finance, or our Medicaid program. Within the Division of Public Health is the Bureau that I oversee, and then within the Bureau, like I said, our child care licensing program. I'm also blessed to oversee our statewide WIC program. We have an administration and policy team, as well as our state palliative care program, which is seemingly growing with more excitement every day. So excited about all of that. Our program, the CCL program, as we call it, is responsible for licensing and monitoring childcare across Kansas specifically. And so licensure for childcare in our state is required by state statute. And then that authority is given to the Secretary of KDHE to write and then enforce regulations. And so we write and do the regulatory work on the side of childcare for our licensed facilities. We don't license individuals, we license the facility itself. And so in many ways, it is similar to long-term care in terms of that. I'll also mention that there's different license types, but the license types themselves can actually be carried out in a variety of settings, which is why intergenerational care can be such a unique model. So our license types, you all are probably aware, but we have what we call family child care homes. Those are your home providers, and sometimes we refer to child care just as daycare. We have child care centers, we have preschools that we license. We also have something called school age programs and drop-in programs. The reason I put this bullet on here is because we might call something a child care home, but that actually doesn't mean it has to be a residential space. It doesn't have to be a home. It is just a license type. And so sometimes those regulations can fit nicely in a space. And that's what it's really all about, is the space for the children in care. And then intergenerational care itself is a model of childcare that supports families across the lifespan. This is done by having licensed childcare on the same site as long-term care. And like childcare, the type of long-term care can actually vary as well. So we have intergenerational care across Kansas currently. Some of them occur in, we have one in a Homes Plus. There's several actually in Homes Plus. There's assisted livings that do some intergenerational models, skilled nursing facilities, and we even have some hospitals that have. It's really not an intergenerational model in that setting, but just to give you the idea that childcare can and does occur in a variety of settings across the state. So whether you're here as a long-term care provider, you're a public health expert or advocate, whatever it might be, we're all affected in some way by childcare across the state and age-friendly policies. So I just encourage you to keep that hat on. And if there's any way for you to advocate in your communities for childcare or sort of spread these ideas across the state, we would love to have that discussion as well. I also have to mention that when I first started here at KDHE, I was chatting with our childcare licensing team, and I, got on my soapbox, right? Hey, I used to work in long-term care. Like, what if we did childcare in these facilities? And they're like, Derek, that's a thing. And I'm like, oh my gosh. And so that was my sort of initiation into intergenerational care. And it really is about supporting families across that lifespan. Parents need childcare for their, for them to go to work, for them to attend appointments, for them to care for their loved ones, and that really affects our aging population as well. And then bringing those two together is an incredible concept that has a lot of factors, or a lot of pros, I'll say, which I'll get into here in a moment. So like I said, the concept currently being utilized all across our state. This occurs in our urban communities. It occurs in rural Kansas. We have quite a few frontier counties, as KHI has done a lot of sessions on those topics as well. And so this is something that's possible no matter the community. Sometimes it comes down to a spacing or a funding issue, which we'll get into as well. Of course, we all know there's a perceived childcare crisis across the state. And so I put a question mark on here. Is this a solution to that? I would say it's one of them. The parentheses there is probably Derek's opinion. I would say one of them. Is it a staffing crisis solution? I would say it's one of them. Like the issues that we have with healthcare staffing and healthcare professionals across the state, recruiting and retaining them to Kansas, especially in our rural communities. Same thing with childcare. Having licensed childcare, especially in our rural communities, there's no one size fits all solution, but it's a multifaceted problem. And so I see intergenerational care playing being a key potential solution to helping address both of the crises that you see here. It is used as a recruiting and retention tool as well for these providers. And so what we've seen is sometimes it can be utilized as an employee benefit. We have one provider that, they have their license for a certain amount of slots for children, and they offer those children to their staff and their staff only. We have other facilities that open that up to the public at large, and so it just kind of depends. And that piece is really a business decision. The state does not have any regulations. We don't play a hand in that decision for the business or the owner operator. But we do see it utilized as an employee benefit. One of the most intriguing ways that I see it utilized is when the business or some of our current intergenerational care models, they'll actually offer lowered costs for their employees. There's a facility currently, one of the Home Pluses that do this. They charge their staff like $20 a week for care for the staff kids to attend childcare in that same facility. And if you know anything about childcare costs, $20 a week is pennies is pennies. And so they kind of utilize that as a recruiting and retention tool as well, obviously attracting professionals to want to work for them. Hey, we can pay for some of your childcare. We have these slots available. By the way, the kids are going to be at the same location that you are working at, which can offer a ton of peace of mind as well. On the regulatory side of childcare licensing, one of the most key components of that is parents having that peace of mind. Childcare licensing is a consumer protection piece, so that I'm a parent, I'm a dad of 3, soon to be 4, probably next week, by the way, that when you send your kids to daycare, and mine go to a home daycare, I have peace of mind in going to work and knowing that they're being cared for in a facility that gets inspected. There's expectations for the staff, and by the way, the director, the owner of that facility, loves what they do. They're hugely passionate about it, and they take a lot of pride in being licensed as well. So thank you for the congratulations note in the chat. I appreciate it. Some of the benefits, though, I guess I would start by saying all of that is great. And promoting this as an economic tool, absolutely true. You've got your employee benefits, recruiting and retaining professionals, again, especially to our rural communities. That's all wonderful. But what I really love to talk about is the benefits for the residents and the children alike. I've talked a little bit about the employees, the staff themselves. But what I love to see, and I've gone on site to several of these facilities, is the residents and the children when they engage in time together. And it's wonderful. And it could be things like crafts together. We've seen them do different snack time activities together. It could be music. It could be, a variety of things. And that's kind of up to the facility. And I've always drawn back to this music therapy. I believe it was called Music in the Brain, was a class I took at Washburn when I was doing undergrad. And I remember learning about how music therapy can be very engaging and trigger memories and trigger the brain, firing neurons and things like that to help our aging population. And what we're seeing is that engagement with children offers many of the same benefits. And so they feel that uh, they feel that engagement with the kiddos, and it helps combat that social isolation piece that we talk about so much, and really I think instills a sense of purpose. One of the other things I'll mention too is that especially in our smaller communities, again, it is common for these kiddos to have relatives in that same community too, and so that's a pretty cool crossover as well. So how does it work? Well, we know that KDHE licensed childcare, KDADS for the most part is responsible for licensing and overseeing our long-term care facilities. We have an existing MOU between the agencies that really outlines the process. It doesn't bypass any regulations or really any part of the process, but it just says, hey, this is possible and this is how we can go about it. How we look at the facilities are 2 separate licensed operations that are both subject to regulation. So the KDADS portion, they have to keep up to regulation on all their sides, or on all of their expectations and regulations. Our licensed childcare facility, same thing. We come in, we don't look at the KDADS portion, we don't have authority to do so. We're focused on the childcare component, and there's the same expectation as there would be any other style of care or location to be in compliance with those regulations. The time that the children typically spend with the residents, and again, they're never unsupervised, it's always supervised. The big key with childcare licensing is the children are too young to be left unsupervised. So there's always supervision, eyesight, providers have eyes on the kids, they're there with them, they don't let them out of their sight. But we typically view this as a field trip. And so sometimes there's forms, there's parental consent to say, hey, tomorrow we're taking the kids to the long-term care portion and we're going to do snack time with the residents. And so there are some things like that in place. I can't reiterate enough that it's 2 very controlled environments. Sometimes people get this image in their head of like, you walk into a facility and it's just like children running through the halls and residents, doing the same, I suppose. But it's not like that at all. It's 2 very controlled environments. And what you'll actually see is in a facility, you'll have a locked door. The childcare portion is very separate. So parents, by regulation, have to have access to the childcare portion, but we do not want residents or, by the way, staff or anybody else from the long-term care portion to have access to the child care operations, because the federal rules have very strict guidelines in terms of background checks, fingerprinting requirements, and things of that nature. So it's also important to keep the population safe. So when it comes to things like infection prevention, especially this time of year, we know flu has been a huge thing. COVID's still going around. And so those things are very important to keep in mind for both populations, to keep them as healthy and as safe as possible. The last thing I'll mention is House Bill 2339. I did have the opportunity to testify in support of that bill. This would have created an intergenerational fund here at KDHE to provide financial assistance through grants to adult care homes so that they could develop and operate child care programs in them. I believe they tabled the bill formally, but hopefully we'll see it picked up in some sort of way. That's usually the biggest barrier to owner operators or providers being able to do something like this, is the financial side that may come with it. So we do see that a lot of long-term care facilities have a pretty good setup already for childcare, but sometimes they may have to do things like an outdoor play space, or do some safety modifications, or bathroom modifications, or whatever it might be. And so we're hopeful that some programs like that will continue to be created and moved forward. And I'm very excited to continue promoting this concept. We have a flyer right here that we have available. And if anybody's interested, you can scan that QR code. It should take you to find a local licensing specialist if you have questions, or want to start your own childcare. And if you have any issues, let me know, and I will take questions if there are any, Emma.
Thank you, Derek. So now we'll open it up for questions. If there's any, and you can submit a question in the chat or the Q&A feature. I have a question. So one adult care home kind of model you mentioned was Home Plus. Can you give us a bit more information on what Home Plus is, what that looks like?
Yeah. Well, so I haven't been in the long-term care space in a while, but my best recollection, and I may be looking at Chrissy here to hop in if she has the background, but or anybody, honestly, Emma. But a home plus to me is a more of a residential setting, lower number of residents. I want to say it's 12 or less. And actually that makes sense with childcare, because I believe there's some fire rules around that number. 12 or less. And so smaller number of residents in a more so residential setting. And the Home Plus that we see utilize that, they actually built um, a separate portion of the home, basically just for the childcare. That's not always realistic for providers. And so, for example, in your stereotypical, long-term care facility or nursing home, as sometimes people refer to them as, we've seen like wings of these facilities turned into childcare, where what used to be a resident room is now a childcare unit, as we would call it, within a center model, for example. And so it's just done a lot of different ways. My
Thanks.
KDAD friends are really going to get on me if I didn't get that correct, by the way. So,
No, I think that was a great definition. I remember, so when I was beginning my career in public health, one of my first jobs was doing health inspections at nursing facilities in the KC Metro. And I'm thinking about all those different types of facilities I saw. And Kansas City is obviously a very urban center. But I'm thinking about this model in rural Kansas. Do you have more rural and frontier areas? Do you have some examples of intergenerational models in rural parts of the state, what that looks like, and maybe some of the barriers that more rural areas are facing when it comes to implementing this model of care?
yeah, absolutely. So, Heritage Homes, I believe it is in Alma. They have and that's actually the one I was talking about, that has utilized an entire wing to be their childcare center. Um, and then there's some other providers as well, out in the western part of the state. There was one in Ellis County. I know there's one in Dodge City for sure. But we've really been trying to grow this concept, especially in those communities. Typically, the barrier comes down to space or available space. We know our long-term care facilities can't afford the margins are already thin there as well as they are for childcare. And so one of the things I didn't mention was most of our owner operators that do this will tell you like, hey, I don't do it to make a profit in the childcare part, but the benefits that I see in the other areas of our operation, that's where we sort of regained that back. We've had the opportunity to go on site to locations to look at spaces like that to say and make recommendations essentially, Emma. So, but it's usually a spacing issue or a financial barrier. Like I said, the issue for most of our rural communities is just the space to conduct childcare doesn't exist.
Yeah.
The buildings are aging. They weren't designed for childcare necessarily. And so typically in a childcare center or even in a home, um, it's ideal to actually have an open space and not have a lot of things that could block supervision. Like I said, kids need to have supervision at all times. And so,
Mhm.
for example, in at Heritage Homes in Alma, resident rooms, they had shared rooms at one point where there's basically a half wall that separated the rooms. Well, to us in the childcare space, that's a line of supervision that's broken. And so you have to consider those rooms two separate units. And that
Mhm.
comes with staffing requirements and staffing expectations for the kids. And so sometimes it's just about a lack of available space or space that's available but needs some tender loving care put into it and some money, quite frankly, to bring it
Yeah.
up to speed. And I think there's also been a lack of funding available in the childcare space, and that's one of the reasons that I think the House Bill 2339 has a lot of promise because it gives funding available for that. Um, the other thing I'll mention real quick, we know that facilities across the state, especially in the rural and frontier counties, long-term care facilities struggling financially, potentially closing or having empty wings. And so sometimes childcare is a good opportunity to use that space in a different way. And again, it's a business decision. So if they find
Mhm.
a way to make a profit off of that, then that's, a benefit for them as a business owner. So
Oh, thank you so much, Derek. That's such a wealth of information for this model, and I hope folks can explore this more for their communities. But we do have to move on to our next presenter, Chrissy. Um, so, Chrissy, if you have slide control, you can go ahead and begin your presentation.
I do. So thank you. And big thanks to Kansas Health Institute for allowing us to talk on this or speak about this subject of financial exploitation. I bet some of you are wondering, like, how does financial exploitation, how does address this topic really fit into advancing an age-friendly Kansas? And we'd like to just give you some background on this. So, for those of you who don't know, the role of Adult Protective Services, we are within the Department for Children and Family Services, and our job is to investigate allegations of abuse, neglect, and financial exploitation for vulnerable adults. We define vulnerable per the state statute. That is anybody that's 18 years of age and older that it's been alleged to be unable to protect themselves. And I stress this because this is the information that's so important. If you or somebody that you work with was to call in a concern to our agency or to our protection reporting center, so you want to be able to share why is the adult unable to protect their own interests and what harm or threat have harm around an allegation of abuse, around financial abuse, mental, physical abuse. We also want to demonstrate how the perpetrator, it's through their action or inaction. And that's what's so unique, again, about adult protective services. When a perpetrator's in the role to protect that adult, they have a responsibility to follow through. A little context, last year, Adult Protective Services investigated over 10, it was like 10,600 investigations, and that was done by 68 protection specialists. So our staff are really busy, really, really proud of them. We are a social service agency. So I stress that because, yes, we do these investigations, but first and foremost, our job is around advocacy. And when we go out to the home and make contact with our vulnerable adults, our job is really to how do we connect them with services and how do we support them in the least restrictive environment. And that language around least restrictive is even in the state statute, but it's also part of our code of ethics. We know that older adults want to age in place. That often means living in the community. So, how do we support them with those services that allow them to do this safely. And lastly, I have to say that this sometimes can be a pain point is around adult protective services at times can do involuntary interventions, but that's really only around when an adult lacks capacity. And that capacity is determined usually by a medical professional. So let's get to the topic of financial exploitation and why definitely within APS, we're seeing this as there's some urgency around this. This data is around cases assigned with an allegation type between state fiscal year 2022 and state fiscal year 2024. And if you look at, there's 3 bars, there's like a blue, a yellow, and then a black. And if you look at the age groups between 60 and 69, 70 and 79, this is really where we're starting to see an increase in cases over time. That 60 to 69 group, we saw a 20% increase. But let's look at that 70 to 79. That's a significant jump from 614 to 887. That was a 36% increase. Why? Well, we know, what is it, about 60% of America's wealth resides with adults 65 and above. So we do believe that older adults are being targeted for financial exploitation. And that is concerning. And we want the community to be aware of this, our state. So who are these perpetrators? Well, I'm going to tell you, they're not a lot different from our other allegations of abuse or neglect. They tend to be family members and caregivers. With family members, we will see maybe adult son or daughter, grandchildren that are moving back into homes. They maybe move back into the home with the intention to try to support that elderly individual, but then maybe they start helping themselves. They start going to the grocery store for the older adult, and they might buy 1 or 2 items. And if they see they can get away with it, nobody's addressed that they're taking things without permission, they might start purchasing more and more items and then just start using credit cards without permission. When we are requesting bank records, we're seeing things around perpetrators, getting things like at the liquor store or going to a casino. So really concerning actions. And we're not talking like $10, $20, we're talking thousands. Other perpetrators are people, agents who are acting under the power of attorney, or they have the legal authority to manage the individual's funds. We're seeing cases like in Western Kansas. Let's say we have an older adult that's got progressed dementia and the durable power of attorney or the power of attorney has been activated. Let's say that perpetrator is then starting to sell off the adult's land, their tractors, their farming equipment, but they're not selling the equipment at a fair market value. We've seen cases where properties being sold for $20, $30 an acre, and we know that's wrong. So those are, again, some cases that are coming to us, and we're working in collaboration with law enforcement. Other perpetrators, romance scanners, internet scams, the telephone scams, stuff you see often on the news media. And then lastly is around home repairs. Adult Protective Services doesn't typically get into those sorts of investigations. We would work with the Attorney General's office. If we received a case like that, we would refer that on to them. But those are the cases where, hey, we'll fix your roof for a low cost. And let's face it, they did not get their roof fixed. So what makes scammers so successful? I wanted to take a second to look at this graph to the right. You'll see a yellow line that goes down. This is a graph that was provided by the Federal Trade Commission, because some people might be thinking, hey, scams happen to everybody. Why are you just focusing on older adults? But it's really around reporting. And you'll see the younger generation, they're really good at reporting it. But if you get down to look at the 70 to 79, the 80 plus, that's 25% report that they've been a victim of financial exploitation. That's 1 in 5. And remember, our numbers, what APS is investigating, is just on vulnerable adults. So when we know this problem is even bigger across the state. But perpetrators are really, really, really good at providing complex information about products, about services, about steps somebody must take to either protect themselves, protect their loved one. And they do it in a manner that's absolutely confusing, and they put a lot of pressure on that involved adult. They want them to react quickly. Now let's sprinkle on a little bit of impaired vision, maybe somebody that has some difficulty hearing on the phone. I'm sure many of you have reached out to a great aunt or a grandparent, and they had trouble hearing that conversation. Maybe they didn't have their hearing aids. So we have complex situations presented in a confusing manner. The adult is expected to respond quickly, and they're having difficult hearing, right? That is a recipe for disaster. Now, let's add some depression or social isolation. We know that a lot of our older adults don't have strong networks of support. So, do they have somebody they can reach out to? Do they have somebody they can stop and ask a question to? Like, hey, does this seem right? So, Adult Protective Services partnered with the Kansas Department of Aging and Disability Services to do a scam awareness campaign. And so I'm going to have just share this campaign. This is something we launched during COVID to help bring awareness to the topic. If we could play that, please.
Each year, more than 3.5 million older adults are victims of financial exploitation in the U.S. Many are afraid to report it, but taking action prevents additional victims. Here's what you can do. Stop. Don't interact with the scammers. Verify the source with a trusted person and report it right away if you think you've been scammed.
Remember, stop, verify, report.
This won't surprise you. With older adults, this is a generation of respect, a generation that a handshake is your word. And so really helping them understand that it's okay to be rude, it's okay to hang up on somebody, and it's okay to say, no, I'm not engaging in this. So what can you, when I think about you on the call, what you can do to protect somebody, I know Commissioner Klukas is going to talk about financial literacy, but whatever we can do to encourage the involved adult to report it. You saw those low reporting rates. So if they've been a victim, how do we encourage them to report the abuse? How might they, like, how can you prepare for a conversation? Like, if you're meeting with somebody that's older, is there one or two people that they believe that they could go to, they could reach out to if they feel like they might be a victim, to help them look at the complex situation so they can make strong decisions? Within Adult Protective Services, we talk to adults about how they can check their credit reports through the 3 major bureaus, put credit freezes on, sign up for no-call lists. We also have conversations around reducing isolation. And an example might be working with the Kansas Senior Centers. We have amazing senior centers across the state and helping those adults build those relationships. And, I just always want to end with, and I think this is just like almost the heart of Kansas. We're down to earth individuals. If something's too good to be true, there's a pretty good chance it's too good to be true. And how do, again, we reiterate that to individuals? Trust their instinct. So as I wrap up, we just want you to know, we have APAs that are across the state of Kansas. And one more slide. Myself and Jessica Snyder is our program administrator within Adult Protective Services. And so if we can ever provide more information or education on this topic, we would love to do that, and whatever we can do to raise awareness, because we have worries that this is only going to increase over the next 15 years. So thank you.
Thank you so much, Chrissy. And if our audience wants to ask Chrissy some questions on some of her information, please keep going in the chat or in the Q&A. And it is my pleasure now to turn it over to Dan to continue the conversation.
All right. I want to talk about a little bit about financial exploitation of seniors and what we're doing here at the Office of the Securities Commissioner, which since 2017 has been part of the Kansas Department of Insurance. So my boss, the insurance commissioner, Vicki Schmidt, is very into helping all Kansas, not just seniors, but we've seen that we don't focus on seniors as much as we probably should. We do a lot of different things, but lately we've developed some cryptocurrency training for seniors, and we're working with Chrissy, who's been a great help in all of our stuff, get that out to the public, because it frightens me. I don't mess around in cryptocurrency because even as a securities commissioner, I don't know enough about it, and I kind of don't trust it. But when, our older folks, they believe that, everybody's truthful, and they see other people making a lot of money in crypto, and they do the same, and they lose a lot of money in that. So, but we've worked with the Area on Aging offices and provided training materials to them. We have an ad campaign on radio because, there's still a lot of people that listen to radio, and our ad campaign really focuses on elderly, and not to be ashamed we need them to come forward So that's a really big thing for us. But last year we were able to pass, we'll skip that. That's just me. We were able to pass House Bill 2562 into law, again, with help from Chrissy, AARP, Area on Aging, actually the industry that we regulate. And the Office of the Securities Commissioner, we regulate your financial advisor folks, right? So your Edward Jones, Coldwell Banker, those people that are out there giving financial advice, we regulate them. And they're all fiduciaries. So, I wanted to talk a little bit about what a fiduciary is. They're a person, an entity that is legally obligated to act in the best interest of the people that they're helping grow interest, or to grow their money, or to just safeguard their money. The fiduciary responsibilities are acting the other's best interest, which is, contrary to what some people might think about financial advisors. Yes, they are in it to make money for themselves, but they're fiduciaries. And if we find that they're doing things that make them money and at the loss to their clients, then we take action on their registration. And we take that very seriously. But I want to say, when we passed this law last year, the industry was very, very supportive of this. They want to do the right things by their clients. And one of the main things that they're able to do under our law is to freeze assets. So if someone has hundreds of thousands of dollars in, and they know that they've been a conservative spender for years, and then all of a sudden they want $100,000 and they're going to buy crypto, or they're going to send it somewhere that doesn't sound right, this advisor has the opportunity to freeze those funds and get us involved. And I worked at DCF for a long time, and I understand mandatory reporters, and not everybody wants to be a mandatory reporter, but we had no pushback whatsoever from the financial community on being mandatory reporters. And they not only have to report to us, but they also have to report to APS through DCF. And we work together with Chrissy and her crew on these cases. Let's see. House Bill 2562, Protect Vulnerable Adults from Financial Exploitation Act. You guys can read it just as well as I can. It only took effect July 1st of 2024. And I was a little bit low in my estimation. I figured we'd get 40 a year. So I figured, well, we'll probably have 20. We had 55 cases reported to us last year, with a total impact of over $1.5 million. Some of that money was frozen and it wasn't lost. Some was already lost by time the financial advisor figured it out. If someone comes in, we had one person who was a farmer, and he had told the advisor, I'm just going to buy some farmland. And that's what this person had done all their lives. But we didn't know that there was over $1 million that it was taken by someone in a romance scam. So we were able to save this gentleman through this act another $500,000 because he just didn't believe that it was false. This is, and the main way we educate them during this act is, first it's a financial advisor, and then it's us. And when they get a call from the securities division of the Kansas Department of Insurance, they pretty much listen. We've had some that argue. I had one lady that told me, Dan, that's not a scam. And then she called me on the phone about 2.5 weeks later crying because she just realized that it was a scam and she had lost $75,000, which may not seem like a lot when you are young and you can make money every year. But when you only have a couple $100,000, to lose that much, it's really going to hurt you for a long time, and you're not going to recover. And Chrissy and I have talked about this several times, that then you are now in the system. So not only did it cost that person money, but it costs the state and the federal government money, because that person can no longer afford to care for themselves. So this is a big deal, and we're just glad we're able to get this law going in the last year. I think we already have 25 this year, and we're only into the second month. So this is huge. And I apologize to Chrissy because I see that her numbers have grown so much in the last 6 months. And I think that might be part of us. But anyway, and I support everything that she does. She's really great to work with. So financial exploitation, this is just from our law. It means the unlawful or improper use, control, or withholding of eligible adults' property, income, resources, or trust funds by any other person or entity in a manner that is not for the profit or the advantage of the eligible adult. You know, basically it's someone that's not doing things for the right reason. And it could be a family member. It could be a romance scam. I hate the term pig butchering, but you hear that a lot out there. And any time of investment scams. Now, we gave the industry the opportunity to freeze those assets, but not every time that money is taken from those accounts is it a security. So we don't investigate all the, well, I don't want to take that back. We investigate all of them and determine where they need to be routed to if it's not for us. So who's an eligible adult? Then we differ from APS. So we have a different age, and they really look at vulnerable adults. We have a lot of people that you would think are not vulnerable. They're very smart. They understand things. Our problem is, as we get older, we remember what we were taught, and we're very trusting. And we are susceptible to scams. And the lady I mentioned that called me crying, she sent me the information. It was not a security, so we couldn't fully investigate it, but we did send it to the Attorney General's office, and they're working on it now. But I looked at the scam, and I went through all the emails that she had and everything I could see, and I'm like, boy, this is believable. The thing that got me was when I sent some of the pictures of this supposed gentleman to our investigators, and this is nothing that most people have access to. They said, all of these photos are AI or they're photoshopped, and they were able to find that. Of course, they found the person that headshot belonged to, and he's just a regular guy, doesn't know anything about this. So his photo was stolen, and she was duped into it, and she was just looking for a friend. I did comment to her when she told me, Dan, I can't believe that out of all the people on Silver Singles, I meet the one that wants to try to take my money. And I told her, I said, I would be surprised if a third of the people on these dating websites aren't looking to take your money. And those are the types of things that when we're able to get out into the field and really talk to seniors and groups of seniors, that we really stress that you cannot trust social media like you think you can. The indicators, and these are the same types of things that you'll see all over: neglect or decline in appearance, grooming, hygiene. You know, some of these people, when they get exploited, they change, they draw within themselves. They're so embarrassed because they automatically think that everybody's going to think they're stupid, right? Or now's the time where all the family has to rush in and, you know, put in the power of attorney, change beneficiaries, do all those types of things, and make them lose basically their livelihood. And that's not the case. A lot of these people are so intelligent, we just fall for scams. I mean, if you didn't fall for scams, there would be no scammers, right? And the last one was unexplained or unusual excitement over a financial windfall or a prize check. We are hearing again, Publishers Clearinghouse. Oh, you know, I need $50,000 because I want $1 million in Publishers Clearinghouse, but I have to pay $50,000 in taxes first. That's not the way it works, but it's hard to convince these folks. So, you know, one of the things we try to stress is everybody on this call, everybody that listens to this, you most likely have loved ones who are going to be, if they're not already, in these situations. And, you know, Chrissy stole the thunder that the amount of America's wealth is in the elderly. They've saved it for years, for a rainy day or for those golden years. And when someone comes and takes their gold, then those years aren't going to be so good for them. I know I kind of ran through this, but I think time was at a limit. So I apologize, but here's our information. And if you guys have any questions, you can reach out to us. You know, make sure that if you are aware of this, contact local law enforcement. If it's an investment advisor, they'll contact us, and they can contact APS. So with that, I will finish. Thank you.
Thank you so much, Dan. And we dropped some great resources in the chat, some investor education resources that the Department of Insurance has been working on. And I will turn it back over to Rebecca to wrap us up.
And so thank you, Emma, Derek, Chrissy, and Dan, so much for sharing your expertise and your experiences and perspective on such an important topic. And so this was a session full of a lot of valuable information. And so we want to make sure that everyone who joined us today can take that information with them. So in the chat, you will find this resource guide. It's 2 pages that has all of the materials that were mentioned today. And I do want to highlight the second page has some really great tools and just resources from our guest speakers today. So you'll see an investor education tool that Dan has shared, the testimony that Derek gave on legislation for intergenerational programs, and also an interview that Chrissy did with KCUR on how Kansas is working to protect older adults. So make sure to download that PDF and check out those resources. And then I know we're coming up on our last minute here, so I do want to give everyone a chance to click on our feedback survey link or scan this QR code. Your feedback and thoughts are really important to us as we design these educational events. So we want to make sure that we continue to focus on topics and use formats that are really meaningful and relevant to you. So if you can please take a couple of minutes to click on that link or scan this QR code and share your thoughts with us, we would really appreciate it. And with that, we just want to say a big thank you to you for joining us over your lunch hour. It was a joy to spend this time with you and to engage in this conversation. So thank you for all of your questions and your insights in the chat. And we hope to see you next Thursday for our final Bring It session on navigating AI. Thank you so much and have a wonderful day.